Staying in the region, UNICEF Goodwill Ambassador Priyanka Jonas calls on the world to act fast to save the lives of children dying from hunger in the Horn of Africa. Priyanka traveled to Turkana County, among 15 drought-affected counties in Kenya, due to climate change and the ongoing impacts of COVID-19, where almost 1 in 3 children are suffering from acute malnutrition. News Centre's Bettina Nwelih tells us more.
In Kenya, the last 4 failed rainy seasons have left 1.4 million kids with restrictions to nutritious food, safe drinking water, health access, education, and protection from violence and neglect. A predicted 5th poor rainy season is expected to worsen the situation, resulting to more kids and families requiring humanitarian help.
You add climate crisis into it that created this drought in the first place, and children are just dying of starvation, not having access to clean water. I'm not even going towards education and healthcare right now because they are dying of basically lack of food. This is a very, very dire situation, and I think people have become desensitized, especially to this part of the world, because this region has had issues of extreme poverty for a really long time. But I want to make sure that this is not forgotten, because suffering like this should not happen to any child. No child should die of hunger, especially in a world where we have so much to give.
In response to the crisis in the Horn of Africa, UNICEF is scaling up nutrition services they provide and distributing therapeutic milk and ready-to-use therapeutic food, RUTF, to health centers, along with supporting authorities to identify and treat kids with malnutrition in the hardest-to-arrive areas.
I'm absolutely worried about the current situation here, and I think the need to worry exists for especially the global community, because this is to be able to see children that don't have access to food and that are dying because they haven't eaten for 4 or 5 days, and for families to accept that reality is heartbreaking, and that is a concern that should affect the global community in a big way.
The numbers this year are very alarming compared to the other seasons. 2 years ago, 2 to 3 years ago, we had an emergency response of the same kind, but the numbers are a bit inflated this year.
Children whose immune systems are already weakened by malnutrition cannot fight off disease, meaning they are just as likely to die of illness as of hunger. UNICEF is calling on all relevant authorities to intervene before the situation gets any worse, as nearly 900,000 children under the age of 5 in affected counties are in need of treatment for life-threatening, severe, acute malnutrition. Bettina, Nwelih, reporting for News Central.